Welcome to today's episode with the National Institute for Children's Health Quality. We call ourselves NICHQ. We're so glad that you're here with us today. NICHQ is dedicated to driving dramatic and sustainable improvements in the complex issues facing maternal and child health. In today's episode, we'll be discussing one of the most challenging journeys in healthcare, and that's the transition from pediatric to adult care. So why is transition so critical? Because for many young people with lifelong or rare conditions, the shift from a trusted pediatric team to new adult providers can feel overwhelming. It's a time when independence and self-advocacy are essential, but when systems don't always make it easy. Helping families and healthcare teams navigate this process smoothly is central to our work at NICHQ. A strong transition can set the stage for better health outcomes and more confident and empowered young people. And that brings us to today's conversation. We're thrilled to introduce you to Mac Starnes, a remarkable communicator and creative professional. Mac lives with congenital bilateral Perisylvian syndrome, a rare condition that affects his ability to speak and eat by mouth. But as you'll hear, Mac has never let that define him. He graduated with a degree in multimedia journalism, works as a photographer and video editor, and brings his creativity and humor to every aspect of his life. Mac brings deep insight in what it means to grow up with a rare condition, to push for independence, and to advocate for himself in healthcare settings where the system wasn't always ready to support him. In this episode, Mac is joined by NICHQ faculty member Kris McCrea to reflect on his transition experience and his vision for how healthcare systems can be improved. As you listen, we invite you to learn from Mac's wisdom, laugh with him, and think about the changes we can all support to make healthcare transitions more effective, compassionate, and patient-centered. Let's dive into our conversation with Mac.
Hi, everyone, and welcome. I'm thrilled to be able to bring Mac Starnes to you today so we can do an interview and hear his experience of when he transitioned from pediatric health to adult health. So, Mac, I'm going to turn it over to you so you can take some time to introduce yourself and tell us a little bit about who you are today.
Hi everyone, it's Mac Starnes. We need to discuss the elephant in the room. Yes, I am a non-speaking person. What a plot twist. I know, I shock myself every time I went with knowing I can't speak in the same as you all. With all seriousness, my condition is congenital bilateral Perisylvian syndrome, which basically affects my ability to speak and to eat by mouth. ChatGPT will give you the extended description for it. I don't want to bore you with all the many details about my condition. I graduated from Lynn University in 2018, down in Boca Raton, majoring in multimedia journalism. Currently going to a school called Vertex School, and it's a game art program. I am a 3D artist. My passion is to be creative in whatever work I do. Also, my passion is for improving healthcare transition for everyone.
Wow, that's remarkable. So imagine being able to bring clearly your humor and your creativity to healthcare. And congratulations on graduating from Lynn. That's amazing. So thank you for sharing that. Let's go back in time for just a moment. I'm curious, when were you or your parents first told about this syndrome?
I don't know the specifics of when and what was going on at the time when I was born. But my parents and all the doctors caring for me knew the day before I was born that I was having great challenges. I told the story that when I was 2 weeks old, in the NICHQ at Children's National Medical Center in Washington, D.C., that a group of specialists figured out my condition based on my MRI and other physical issues. My syndrome is in the ultra-rare category of rare conditions. There was only one journal article about Perisylvian syndrome when I was born, based on 20 other people in the world. I knew I was different from the get-go, but I didn't really know and understand the full name of my condition and the story behind my diagnosis until around, I want to say, the 5th grade. As I began to learn about my condition and all the details about it, I bet I was thinking, do I have to remember all of this stuff? I blame all of you in the medical community for having me have to read this long medical name and all the other medical details.
That's funny. So I can't imagine like your parents finding that out the day before you were born. That I'm sure was difficult for them to hear. And like 1 in 20 other people. Wow. You are 100% correct. You are special in a lot of ways. So it is interesting how we in healthcare do almost demand that patients remember all of these medical details. So I'm curious, as you've kind of grown up and thought about that experience, what suggestions might you have for us in the medical community on ways that we could decrease the complexity of the system so that you don't have to remember all of the intricate details?
Suggestions so that I can bring the patients into the healthcare discussion early. Years are the best time to start bringing them in. Start with baby steps like explaining, in the simplest terms, explaining the reasons why you need their vital signs, etc. If you do that, then over time they will become knowledgeable about their health care.
Profound, like baby steps over time. Incredible ideas on how to help people to really have a deeper understanding of their health and be able to process what's occurring with their providers in their visits. So I can imagine that it was a little bit different for you growing up. So tell us a little bit what your life was like as you grew up from an infant. What were some of your experiences?
My parents were very supportive throughout my whole childhood and school years. They let me and my sister explore different interests like karate, acting, music, etc. Pushed us to be the best we can be at school and as a person. My older sister was the best sister in the whole world. Wait, hold that thought. Sometimes she was the best sister in the whole world. School life was bumpy for me because it's hard to connect with my peers, and I got bullied as well. It's easy to bully someone who can't speak up in real time in the same way as everyone else, but I still have had friends throughout the years, despite the bullying. I had nurses in the day following me to classes, and at night early on, due to being on a ventilator and other mechanical supports. But gradually over time, the night nurses work faded out during my early grade school years, once I was no longer on those supports. Then also gradually, I had the school nurse stay at the nurse's office while I was at my high school classes on my own.
Wow. It's really great to hear that you were able to establish friends despite the bullies. And I'm sure it felt liberating each time you were able to become a little bit more independent. I hear you on the sister thing. Sometimes they're great, sometimes not so great. So tell us a little bit more about perhaps one of your memories of being involved during a medical appointment.
I do remember that my mom wanted me to assist with her forms at the doctor's office when I was young. She also had me sign in and talk to the people behind the front desk. Gradually, when I was a teen, my mom, my pediatrician, and I would be at the appointment, and the doctor would talk to me alone about my health issues and health in my life in general. This was helpful so that I could put in real-world practice to be ready for when I was able to go to my own appointments and talk about my health without any help.
Wow. So it sounds like your mom was a real advocate for you. And what a powerful message of no better way to learn than actually practicing. So the signing in and really engaging with the provider in your visit, that's amazing. I spoke with your mom earlier, and one of the things that she shared with me is that you went to summer camp as a kid. So how did that experience help you continue to build your confidence on being more independent?
The reason why summer camps were a benefit for me is that it gave me more real world experiences to understand and properly act on understanding about my health. Camps put kids in charge with their own health. Any help from parents or nurses to the best of their ability, of course. Camps will prepare kids for life situations regarding their social their personal care, and their health care. For example, it gave me confidence to understand my health a lot better, like feeding myself, suctioning myself, what medication I was supposed to take, and understanding how I felt, and listening to my body. The camp nurses and the counselors around me didn't know my health better than me. Camps were a safe way to test myself, to know if I really could take care of my health and myself.
Wow. That's quite a testimonial for camps and the independence that they help, right? Really a gift almost to people with multiple healthcare challenges. So congratulations on being courageous, because it takes a lot of courage to do what you did and really be able to learn all of that. So congratulations. And you're definitely not alone on wanting to be independent. Like, it's one of my core values, and it really is important, I think, for everyone. So I'm curious, when did you begin talking about transitioning to adult care? And what kept you motivated? So you talked a lot about learning the skills to feed yourself and to suction yourself. You talked a lot about those skills and learning those more in camp. What kept you committed to learning those skills that you need for everyday life?
I don't know the specifics about when I began talking about adult care transition, but I want to say it was when I was 15 or 16.
Oh, wow.
I had to work on it because I knew I wanted to go away to college.
College, I'm sure that's definitely a motivator. So that's really amazing. So let's get a little more detailed about how you started navigating, becoming confident around managing medications, because they're pretty complicated. What tools or strategies helped you with that?
Good question. I have a 5-page document which has all my medical information from over the years, including my medications I use on a PRN basis. I give this document to my doctors when I go to them for the first time. My medicine list is very limited because I am allergic to penicillin, sulfa, and cephalosporin. So, it's easy for me to remember what I use. If I forget one medicine, I can go back and check that document. I suggest that your patients create an updated document of all their medical information and keep it handy.
Great idea. Sounds like a pretty powerful tool and could benefit actually probably all of us from doing that. So, how are you doing at navigating the complex world of insurance? From your perspective, what would help you trying to do that?
One of the hardest areas to understand was whenever there is an issue, they won't work with me by email or a portal. I have to talk to them on the phone. So, unfortunately, I have to get my parents to help me to make a phone call to my insurance. Then there is the issue of proving I am me on the phone, and that I give permission from my parents to make the call with me. It's very frustrating.
Wow, I can imagine that is frustrating and, needless to say, quite inconvenient for you. It sounds like there might be an opportunity for you and I to partner on taking on the healthcare industry and doing some process improvement work together. So, based on your experience, as you made that transition to adult care, have there been times when things perhaps didn't go smoothly? If so, how did you handle that? And how did those experiences help build your confidence?
My transition to adult care didn't go smoothly at all.
Mm.
My transition to adult care was when I was preparing to go to college.
Mm-hmm.
From being accepted as a patient in adult doctors' offices, time and time again, for many reasons. Some of the reasons were, we are not accepting new patients. My condition is too complicated for them. We aren't taking your private insurance right now, etc. While I was at Lynn University, I had to go to the emergency room or the part-time health. Funny
Wow.
in college if I had a health concern. Luckily, I only had to go to the emergency room one time while I was at college. Other than that, I was golden. Another experience still absolutely baffles me to this day. When I moved back home after college, I was looking for an ENT doctor. My pulmonary doctor suggested a physician she knew. All my paperwork was sent to this new ENT clinic. I set up my first appointment, and all my patient portal information with them. They never mentioned anything about my having a trach. Then, when I went to the office for the first visit, the person at the front desk told me, "Sorry, we don't accept trach patients here." I acted properly and accordingly, and said thanks for this information, and moved on with my day. But, in my mind, I was blown away with the response. That office was an adult ENT clinic that specialized in ear, nose, and throat care. I thought medical school was supposed to teach all things related to ENT care, including trachs. The icing on the cake about this is about a month later this same ENT clinic sent me a bill for being an no-show patient. Unbelievable, right? With all those experiences I have with doctors' offices, you can't let this bum you out. Because there are always some doctors who hopefully accept complex patients, like me.
Wow. I'm glad we got to the final part, because that's a good thing that you have a good team of doctors around you, because it's really important. It sounds like, though, you definitely have had some bumps in your experience in that transition. And going to the emergency room as a patient with complex needs, I'm sure feels very scary. Interesting that the ENT didn't take that into consideration, that you had a trach before you got there. So, wow. I got to say, I'm pretty impressed with your positive outlook, though, and that you don't let that stuff bum you out, and you just keep going until you find the team that's right for you. So that's commendable, Matt. Like, really amazing. Not everyone's able to do that. So, really kudos to you. So kind of again, as we think back, what are some tools that helped you build confidence and independence? So I'm curious, did you use apps, or, you mentioned the document for your meds. What other kind of tools did you use?
Use my Bilateral to Go, which is my communication app for every interaction. The site I use most is the patient portals for my doctor's offices I go to, because it gives me access to make appointments and communicate with them without having to make phone. Also, I hope that clinics and health systems will make the portals more accessible and easier to use for everyone. Also, I recommend they have other options to communicate with clinics, like phone and email, because it is limiting for the office to just have one way of communication with their patients. Not all people want to call them, like me. I think it's way easier to set up an appointment through the patient portal than it is to call the office.
Absolutely. So that is a great piece of wisdom for people to really take away, of really looking at their patient portals and understanding how accessible they are, and developing different ways to communicate. You're a great example of how phone can be really cumbersome. So to wrap up our conversation today, I have one last question. Thinking back on your experience, was there a healthcare provider who stood out to you? Perhaps someone who supported you in a meaningful way?
There were two people that stood out for me. People are my primary pediatrician and my old adult physician. When I went to see my primary pediatrician, I felt like when we had our appointments, he treated me as a human being and not another patient in his roster. He was very interested with both life and health aspects. I think he is a prime example of what a doctor should be. After I turned 18, he let me stay a little bit longer until 21 years old. I believe it meant the world to me back then and still does. The other person was my old adult physician at a special program at Orlando Health called Complex Care and Transition Program. She took on patients who have complex medical conditions as their primary adult physician. She was my first doctor in the adult medical field. Was absolutely an amazing doctor. They were both similar to me because they wear their passion on their shoulders, and it shows how they treat their patients as human beings.
So important. Everyone wants to be treated as a human being, right? That's amazing. And the fact that one of your docs gave you a little bit extra time to make the adjustment is really important because we don't always do things the way it's supposed to work on a schedule. So that's great. That's really, really a good thing to hear. So thank you so much for taking time today to share your experiences with us. You have given us a great deal to think about and to consider. As I reflect on our conversation today, I wanted to kind of summarize the things that I heard. And so some of the things I heard today were reminding us to take some baby steps over time and find out what motivates people. So for you, college was really motivating. Being independent was motivating. So finding out what those things are. And then really encouraging patients to be able to participate in their visit. So you gave great examples of being able to sign in, be able to communicate one-on-one. That's awesome. And then the document, everyone probably should create that document of their meds and what a powerful tool that was for you. And then remembering to really look at our patient portals and make sure that they're accessible and helpful for our patients, and challenging ourselves around the communication options that we offer to patients, making sure that they work for the patient, right? Yeah. You also talked about having some education and simulation on the portal to help, and I think that's a great idea. Most of all, though, your last one, remembering everyone is a human being first. That's powerful. And if we could just start there, what a great place to be, right? Yeah. So thanks again so much, Mac. And as we kind of close with our audience today, I'm curious, after you've heard Mac's experience, what did you learn from him? What did he share with you today that really hit you, really spoke to your heart? What ideas for change do you have based on what you heard? And use his recommendation. Just take baby steps over time to make the changes. So, is there an idea that you would like to perhaps test in your practice or your area of expertise by next Tuesday? Give it some thought. Thanks for joining, and thank you, Mac.